Jayachandra Reddy is the founder of Yoga Prana Vidya system in its present form, which has been adopted by many organizations all over India and a few places abroad. He did his engineering in electronics and communication from the Osmania University, Hyderabad, and has also completed M.Tech in fiber optics from IIT Delhi. He served in the Indian Air Force for 21 years and retired as a wing commander. He also served as a professor in an engineering college, worked and mentored in a telecom company for a few years. He has been involved in Yoga Prana Vidya for more than 20 years and has healed a lot of people. He has been an icon of inspiration to youth everywhere and has relentlessly worked and conducted a lot of seminars, retreats, and workshops throughout the length and breadth of India. He has brought about a new meaning to spirituality through Yoga Prana Vidya. And has brought immense clarity about the science behind spirituality. He has also been instrumental in developing many healers and trainers. His ultimate aim is to have at least one Yoga Prana Vidya healer in every family to bring about peace on earth.
So we're probably running.
N. Jayachandra Reddy is the founder of Yoga N. Jayachandra Reddy is the founder of Yoga Prana Vidya system in its present form, which has been adopted by many organizations all over India and a few places abroad. He did his engineering in electronics and communication from the Osmania University, Hyderabad, and has also completed M.Tech in fiber optics from IIT Delhi. He served in the Indian Air Force for 21 years and retired as a wing commander. He also served as a professor in an engineering college, worked and mentored in a telecom company for a few years. He has been involved in Yoga Prana Vidya for more than 20 years and has healed a lot of people. He has been an icon of inspiration to youth everywhere and has relentlessly worked and conducted a lot of seminars, retreats, and workshops throughout the length and breadth of India. He has brought about a new meaning to spirituality through Yoga Prana Vidya. And has brought immense clarity about the science behind spirituality. He has also been instrumental in developing many healers and trainers. His ultimate aim is to have at least one Yoga Prana Vidya healer in every family to bring about peace on earth.
Namaste, good evening. Today, on behalf of Yoga Prana Vidya organization, I'm here to talk about how YPV healing have helped a person to come out of his heart blockage and avoided open heart surgery. Isn't it a very interesting topic? Let us further read about this topic, about the paper published on this particular ailment. Reversing heart blockages. First, let us understand what exactly happens when a person or anybody is undergoing a tough time. Sometimes rare diseases are very tough to diagnose because most doctors don't see them. The irony of the rare diseases is that a lot of people have them. Some of the research has, even after so many research diagnose and so many of the treatments again and again, a person may not get the actual solution for his problem. We can see this in our day-to-day life, isn't it? Some patients' condition are also so unique that no proven treatment methods are available to help them recover. So patients tend to enter a diagnostic odyssey. They go to a doctor after doctor and suffer for years not knowing what is exactly happening and needs fixing. So sometimes we don't even know the root cause, but in so many diagnoses, it is not visible only that what exactly is the problem. YPV energy healing offers patients the hope of resolving rare diseases through tried and tested energy healing techniques alongside modern medical intervention. YPV healing is an alternative, and in some cases, it acts as a complementary healing system. So let us see how YPV healing have helped this person to come out of his heart blockage. Before we go with the exact point, let us first understand what is or how does heart function, or about the circulatory system. To understand the causes of the heart disease, first let us understand the heart. As you can see here, heart is a very small organ in our body. Of course, it is not very small and it is not too big. Heart is one of the very important organ in our body. So basically, the heart has 4 chambers. We can say uppermost 2 chambers and lower 2 chambers. The upper 2 chambers are called atriums and the lower chambers are called ventricles. So if we divide it as a whole, we will have 4 chambers in our heart. So the right side of the heart moves the blood to the lungs through the pulmonary arteries, and lungs purify the blood and oxygenate the blood and gives the blood oxygen, which is oxygenated to the left side of the heart through the pulmonary veins. The left side of the heart then pumps the blood through the aorta out of the rest of the body. So this is a very basic function of the heart. So what happens if there is a problem, or why there will be a problem in heart? Let us understand. So heart is a muscular organ. Heart is a muscle that pumps blood through the circulatory system by expansion and contraction. We already know this, isn't it? Any condition that affects the heart or its functions result in heart disease. If there is a problem in circulation or expansion and contraction, there will be an issue with the heart. So what are the common problem with the heart ailments? It may be cardiac arrest, it may be block in a heart, or valve disease, or congenital septal defect, high blood pressure, arrhythmia, and much more. So now let us talk about the exact case what we are talking with. So here the patient who have undergone this particular problem was having a heart block. His age was 48, male patient, and he was from Hassan, Karnataka, India. So prior to this condition, prior to this particular incident, he didn't had any medical symptoms, or he didn't had any medical complications. For example, he didn't had blood pressure or heart ailment prior to this episode. Then what happened? One day, the patient had a severe chest pain and burning sensation near the chest area. All of a sudden, this particular patient experienced this severe chest pain and burning sensation in his chest area, and he rushes to a person who was a healer and his neighbor and asked for help. On the suggestion, so before this, when he had the symptoms and he went for help with a healer, so the healer healed the patient, but even after healing, his condition got little subsided, but it was not helping him a lot. So the healer suggested the person to visit the doctor because it was an emergency. So on the suggestion of the YPV healer, the patient rushed to the hospital and the emergency doctor performed the angiogram test. So they had taken his angiogram report. The report revealed that a 90% block in the arteries of the heart. So he was diagnosed that he has a heart block, which is 90%. So the doctor suggested immediate heart surgery and the patient was relocated to the hospital in Bangalore for the surgery within the next few days, as there was no facility for it in Hassan. This particular person is from Hassan, and he went to a doctor for an emergency condition. So the doctor has suggested that he have to undergo open heart surgery because there is a 90% block. So this is a pre-healing condition. So what was diagnosed here? So let us try to understand. So here in the report, in the angiogram report, they have stated that there is a block in coronary arteries which supply blood to the heart. So there was a block in the coronary artery, and in the two divisions, in the subdivisions of the coronary artery. In coronary artery, there are two divisions, that is right main coronary artery and the left main coronary artery. In the left main coronary artery, there is a subdivision, or we can say sub-branches, was also blocked. Here they have mentioned that his left anterior descending artery and left circumflex artery was blocked. That means there was a block in three particular arteries, and the block was about 80 to 90%. So they have suggested for an immediate open heart surgery. So let us understand now, what is open heart surgery? So we all must be aware that what is open heart surgery. Of course, it is not a very happy situation for the patient and as well as the family member. So the patient have to undergo a lot of crisis, and so as the family, right? So the heart surgery is an invasive process that requires the surgeon to cut into the chest cavity. So open heart surgery, as the name itself suggests, they will cut the chest apart and they will perform the action of removing the blockage wherever the problem exists. It redirects blood around the section of a blocked or partially blocked artery in the heart to improve the blood flow. More blockages are possible in the future because the surgery does not cure the disease that was responsible for causing the heart blockage. The surgery only helps to alleviate the symptoms of the chest pain and shortness of breath. We all know about this, isn't it? Wherever there is an issue, if we are not taking it from the root, again it will come. Isn't it? That's why even after a lot of recovery, also complete recovery, also doctor will always suggest to come back and to have a checkup every 6 months or a year, depending on their condition. Right? So of course, open heart surgery was an emergency condition which was required to this patient because the blockage was causing him, and blockage was not helping him to circulate the blood. So it was an emergency situation. Now, at this particular time, healing helped this patient. Let us understand how. YPV energy healing is a process of cleansing the energy body of the patient. Energy healing does not directly work on the physical body. We all know that we have several bodies, panchakoshas, we can say, right? So as we have a visible physical body, we also have another body which is attached to the physical body. It is called pranamaya kosha, or energy body. So whatever happens to the physical body happens to the energy body. Whatever happens to the energy body happens to the physical body. That means these two bodies are interconnected. YPV healing offers a healing in terms of pranamaya kosha, or energy body. What we do in any particular case is we remove the diseased energy or the energy which is causing a problem in the particular area or the related energy center, and we thoroughly clean the affected area and we energize or we give fresh prana to the particular organ or the energy center, which help the energy body to recover. In turn, when the energy body get healed, physical body automatically become healed because both are interconnected, right? So applying cleansing and energizing technique to the affected part and chakrams help to balance the energy body and chakrams that have physical and psychological functions. So this result in the recovery of the patient. So the healer have started the healing even before he have gone to the hospital. So healer recommended that he have to go to the hospital because it was an emergency situation. So after he went to the hospital and he was diagnosed with a 90% blockage in his particular artery, then he was advised to go for further investigation in other hospital. So the healer started healing prior to the patient consulting the doctor and also after consulting the doctor. So what happened in this particular phase was we will get a call that patient needs healing and healing needs to be continued. So we have continued his healing even after he was traveling to Bangalore. So the conditions was like this. So he was taken to Bangalore hospital on the particular day only, where he was diagnosed as 90% blockage and he needed immediate heart surgery. He was immediately taken in an ambulance to the hospital, Bangalore hospital. So when he was admitted in the hospital, doctor noticed there was a swelling in his left hand because of some infection or any condition or because of some condition. So the surgery was postponed. Surgery was postponed to after 2 or 3 days. So they have to be waiting in this particular moment. So, but we started healing the patient thrice a day. So we give healing to the patient thrice a day. So after first day of healing, the symptoms of the chest pain subsided and burning sensation and the chest congestion was relieved. So this happened on the first day of the healing. After he was diagnosed and again he was taken to Bangalore hospital. At the night, he was relieved from the chest pain and from the burning sensation. After 3 days of healing, his physical condition was stabilized. And at the day of his surgery, doctor wanted to take one more angiogram to confirm that how the things are going on. So at the 5th day, when the surgery was about to have, or when they are about to have the particular surgery, they again did an angiogram. And in that angiogram, it was stated that the blocks was gone. Okay, so another angiogram test was concluded that it was found that heart did not have any blockages. So the bypass surgery was avoided. So this is the post-healing condition. This is the angiogram report after 5 days. So the open heart surgery was avoided. In the main coronary artery, the blockages was completely removed. In the left main coronary artery, the blockages was completely removed. In the left circumflex artery also, the blockages was completely removed. In the left anterior descending artery, 80% blockages was reduced to 20%. That means in the 2 arteries, the blockage was completely removed, and in 1 artery, there was a blockage of 20%. Yeah, so they have concluded that this person is no longer needing open heart surgery. So the surgery was avoided, and it was advised to a patient that he have to have a routine checkup every 6 months or yearly, so that there is no further complications, right? So this shows how YPV healing have helped this person to come out of his very, very, very critical condition. Of course, it was a painful condition to a family person also and to a patient undergoing this particular phase. Here, the YPV have helped a person to come out of this difficult phase just in 5 days. So YPV healing is very powerful and act as alternative in some cases and complementary in all the cases. So to learn about or to read about this paper more, you can click the link below, which is there in the description box. And if you have any doubts to clarify, you are free to ask any questions, and you can contact the number shown in the slide for further more clarifications.
So there was one question coming. I would like to answer. There was a question that is YPV healing helps only in heart ailment or other ailments also. So as we have mentioned earlier, YPV healing is a holistic approach, and it acts as a complementary healing therapy in almost all the cases, and it acts as an alternative healing system in some cases. So healing not only applicable to the heart ailment, healing is also applicable to all the cases from general hair loss to even more complicated cases, right? So healing can be applied to any person at any time undergoing any physical, psychological, or any issues. So healing can be applied to almost all the ailments. So there is a statement, anyone can be healed, any patient who is receptive, humble, can be healed from any particular ailment the person is undergoing. So if there is further more questions, we would like to answer. I think no more questions. So I wish you all very happy Diwali. And there will be every month, first and third week, this research paper discussion will be there from Yoga Prana Vidya Association. So please kindly book your slot and attend this particular book study every month, first week and third week. See you all. Good night. Happy Diwali. Oh, sorry, 1 minute. There is one more question. How much time it will take in psychological issues? So it depends on case-to-case basis. So we cannot exactly say a person can be healed in this particular day or this particular time only. It depends on the person. But of course, a person may change result in first healing itself. He may feel certain difference before and after healing. So to completely get rid of some issues, he may take some days or months depending on the severity of the problem. I hope this answers your question. Yes. So we can end the session now. I wish you all once again happy Diwali. See you all. Take care.